Welcome to Ask an MS Expert Veterans Program. I'm Ashley Lee, and I'm the host of the Elite Warrior Project podcast, which is designed for veterans and active duty service members diagnosed with multiple sclerosis. I was diagnosed with MS in 2017 while serving in the Navy, and have since then directed my time and energy to helping veterans and active duty service members who have been recently diagnosed with MS. I want to thank you for joining us here today. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. We will also highlight important resources and services available through the VA. MS navigators are online throughout the program, answering questions and providing resources. So please post any questions or comments you may have throughout the program in the chat box. I would like to acknowledge and thank today's national sponsor, Walgreens. Support from MS community partners helps the Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert. November is National Caregivers Month, and we just observed Veterans Day. So today's program is well-timed. First, I want to thank my fellow veterans for your service and sacrifice. My brothers and sisters, we took an oath to serve and protect this country. We sacrificed blood, sweat, and tears. We answered the call when many did not or could not. And I want to personally tell you that I am proud of you and that I appreciate your service and sacrifice to this country. I also want to thank all of the care partners and everything you do and the sacrifices you make to support loved ones who manage MS every day. We couldn't do it without you. And as you know, MS affects our partners, our spouses, family, and friends, which is why today we will talk about how we can build a better partnership with our care partner, how we can support each other, tackle decision-making, adjust to new relationship roles, and learn about valuable resources from the Veterans Administration and the National MS Society. Let's meet our experts for today. Ebony Lyle is a senior social worker in the Caregiver Support Program at the VA in St. Louis. She is a licensed clinical social worker who has worked in various mental health settings with children, adolescents, adults, and families. She has experience working with individuals diagnosed with severe and persistent mental illness, ALS, multiple sclerosis, and individuals dealing with life transitions. I would also like to invite Margie and Nick, who are college sweethearts, who loved being a military family for 23 wide range of activities and responsibilities to manage, just as there are a wide range of abilities and disabilities among people with MS. Ebony, tell us what a care partner role may look like for someone with MS and what types of responsibilities they may have.
Yes, well, thank you so much. First of all, I would like to thank you all for this opportunity. It is certainly an honor and a pleasure to be a part of this program today. Thank you to the veterans. Thank you for your service, and thank you for the care partners and all that you do as well. So yes, that is a great question. The care partner certainly has a wide range of responsibilities that can vary or look different from veteran to veteran and from care partner to care partner. For example, some of those responsibilities may include care coordination, that's scheduling appointments, keeping in contact with those providers, being able to remind the veteran of appointments. That can also look like providing transportation to and from appointments, or even coordinating transportation to and from appointments. Um, that can also look like actually attending appointments with our veterans, right? Being able to be there as a care partner, advocating not only for the veteran, but for yourself during those appointments, asking questions, getting in there, getting involved, and receiving that education that is necessary for the course of this journey. And other responsibilities may also include providing that emotional support to your loved one, right? As this journey progresses, everyone needs emotional support, both the veteran and the care partner. Another role may be just being flexible in what you do, realizing that over the course of this journey, roles may change, being able to adapt to the changes that occur as the disease may progress. For example, that may look like you taking over the transportation needs, or you taking over the household chores, or cooking needs, or things of that nature. So again, those responsibilities definitely vary, including medication management, right? Being able to order those refills, keep in contact with those medications that need to be updated, setting out that pill planner so we can make sure that we're staying on top of times and things of that nature when it comes to medications. So those are some of the roles that care partners may have when helping and caring for a loved one.
Absolutely. Thank you, Ebony. It seems like the more you learn about MS, the more you'll be able to deal with the challenges ahead. Nick and Margie, tell us about how you approached learning about MS together.
Hi, that's a very good question. We obviously, well, given my diagnosis date, the internet and everything was pretty new, and I did a lot of learning, believe it or not, still online. And I contacted the MS Society website way back when, and tried to learn about what was going on back then, which was a lot easier than today. So
No, I was in denial. There's no definitive test for MS. And I thought, are you kidding me? Him? No way. There's no way he has MS. He's active duty, STRAC, HUA, all that stuff. Just, there was no way that I wanted to believe that. And so I think I'm, kind of the eternal optimist. And I kind of didn't look into stuff at all originally, just thinking, nope, they're wrong. He's got this, no worries. And we kind of went along that way for a number of years because he, at that time, was in relapsing remitting. And so his symptoms were noticeable to him, but not necessarily to anyone else. And, we had two young boys to raise, and we just stayed busy with life. I did do some looking into it originally, just, but I think you can scare yourself to death, if you look too much and see all the sad stories and everything. And so I think we approached it differently. We did it our own way, and and gradually you just come to grips.
Yeah, thank you, Nick and Margie. I can relate to that, being in denial. So absolutely, thank you for sharing that. Ebony, when a veteran is diagnosed with MS, who can they reach out to for information and support, and how should they get their care partners involved?
Great question. So when receiving that diagnosis, it can be overwhelming for both the caregiver and the veteran diagnosed with it. And as Margie mentioned, sometimes there is a level of denial. Like, is this really the case? What's going on? So we really encourage care partners and veterans to reach out to the MS Society, their local chapter. the MS Society is a wealth of knowledge. As Nick mentioned, it's a turning place for people to get those resources, to get that education, to get that training, and moreover, just to find that support system with people who may be going through similar situations. So we really encourage that outlet. And as a veteran, we also encourage both veterans and care partners to reach out to their local VA. Oftentimes, some VAs are staffed with what we call a MS clinic, again, a multiple sclerosis clinic that is dedicated to the treatment of MS. So there's a treatment team there of dedicated professionals and experts in this field. For example, that treatment team may consist of a doctor, nurse practitioner, nurses, social workers, physical therapy, occupational therapy, just a whole team of people that can really be there to provide that treatment, navigate the diagnosis with you all, navigate the system with you all, provide that level of education, and just really provide that level of support that you can turn to when you do feel overwhelmed. And again, I really want to hone in that this treatment team is really there for both the veteran and the care partner because it's a journey for both of you. So we really like to bring that home as well. Um, so those are the two real main resources that I would encourage. Again, the MS Society and your local VA for support. And again, just to follow up with that, it's very important when it comes to getting your care partner involved. Care partners attend those appointments. Don't be afraid to speak up and ask those questions. Get involved. Ask for training opportunities, educational opportunities, research, things of that nature. So please don't be afraid to ask questions.
Yeah, thank you, Ebony. I think that's a really excellent point that you bring up. So we heard from Scott, who is living with MS. And Nick, this question is going to be more for you, okay? What is the best way to explain so that my partner can understand how I am suffering with tiredness, weakness, memory issues, and fatigue? So what we want to hear from you, Nick, is how you explain to Margie your changing symptoms and needs.
Well, I tell you, I was a failure in this part initially, and probably still am. Based on my military background, I was a can-do, kind of keep it all to myself kind of guy, which is normal for the military, I think. And but now I've come to the realization that, one way or shape or form, I let Margie know what's going on, how I'm feeling, so she can kind of react and help me as much as she can. Anyway, but like I said, I wasn't very good, and I'm getting better.
Mhm.
Absolutely. And I'm sure there's a lot of veterans that can relate with that, expressing our feelings and how we're feeling symptomatically. So I appreciate your honesty there, Nick. Thank you. Becoming a care partner, okay, can be deeply satisfying, but it can also be physically and emotionally exhausting. It can disrupt a relationship and impact intimacy, responsibilities, and communication, which can strain the best partnership. So, Ebony, let's start with you first. How are relationships impacted when one partner becomes a care partner? And what advice do you have for couples who are navigating relationship challenges?
Another great question. We get this question quite often because, again, going back to what I originally stated, roles often change, right? So the context of the relationship, they're good, there could be changes. So for example, I really want to hone in on this concept of balance, right? So when you find yourself in this care partnership relationship, care partners can find themselves really kind of sucked into this role of being a nurse or an aide, right? So then and therefore, care partners may lose that, lose sight of being a spouse, right? Being that partner in a spousal sense. So I really want to just touch base on spending quality time together. That's the key, right? Reminding ourselves of the relationship and what brought us together in the first place, right? Making sure that you carve out time with one another. That can be coffee in the mornings, right? That can be, this is our time to share what's going on, to talk about memories that we share with one another. Maybe coming up with collaborative efforts of how we can make sure that we're spending that quality time together. Would we like to watch a movie together or read a book together? And being able to really hone in on those collaborative efforts of quality time. And again, not losing that sense of the relationship, right? And not letting that nursing role overpower or overtake the relationship, and finding balance between the two of those. Another kind of issue that has come about within the context of relationships is sometimes care partners have reported feeling invisible, right? Feeling as though maybe sometimes all of the attention may be focused on the veteran and the veteran's needs, and being able to balance your needs in the context of the relationship. So with that, I really want to encourage care partners to really speak up about your needs as well within the context of the relationship. Um, and so again, balance, balance, balance.
Excellent. Thank you, Ebony. Margie, so this question is for you. Being a care partner, how do you balance being a spouse versus your role as being a care partner?
Well, as Ebony said, it's hard. It's really hard, and I'm not terribly good at it. I'll be the first to admit. I think one of the thanks. I think one of the blessings of MS is that it's a gradual progression. So I think that gives me as a care partner and Nick as the veteran time to sort of cope with things. Like I really feel for these, our young heroes that one day they're fine, they're out on the battlefield, and then, thanks to an IED or whatever, they are suddenly completely changed, and you don't have any time to sort of wrap your head around those changes. And with MS, at least with Nick, the beauty was that it's kind of been a gradual progression. So he was doing, most of his self-care for years on his own, and things were kind of about the same. And then as his disease progressed, my role as a caregiver kind of increased. And so I think we had a little bit more time to be able to maintain that sort of spousal connection and still sort of integrate it with the caregiver part. Now that he needs pretty much around the clock care, it's harder because I think, the blessing and the curse for me is I am a registered nurse. So I find myself, it's very easy for me to put on that nurse cap and go with that role. And sometimes I have to remind myself that it's him. It's not just another patient that I'm taking care of. Not that I, take care of patients without caring, really caring for them. But sometimes it's hard. You just get caught up in the duty of and the procedure, as opposed to, I don't know how to put it into words, but sometimes, some of the things that I do as a care partner, they're not pretty, and they're not, they're not, it's not romantic, not at all. And it's hard to then, flip that switch from, okay, so we just finished bowel care and now we're, let's cuddle or something. It's hard. It really is. I'm not gonna lie. But we try, and we understand as a couple that he gets it. He gets that it's hard for me to sort of flip that switch, and it's hard for him too, because he's obviously, this is not his choosing to require the care that he needs. So anyway, I guess that's a very long way of saying it's a work in progress. We try, and we actually we see a marriage counselor through the VA. Because of things like this, because it is hard. It's hard to know what to do. And sometimes you'd like, an outside, non-biased participant to say, you got this, you're doing all right, and so anyway, and that's another avenue I would highly suggest to people, is that the VA, get some outside help, because it really has been terrific for us. And it's kind of a reminder. We get these homework assignments, and it's a topic every week, and it's things like what brought you together in the first place, or what are your values, or how do you just communication tips and helps and things like that. And it reminds us of, who we were before MS decided to join our marriage.
Yeah.
Absolutely. Thank you for sharing that, Margie. So let's talk about communication, because we know that this is important. Being able to talk to your partner candidly is essential, but it's especially necessary for couples in which one person is taking care of the other. So Ebony, why is it important to work on open and honest communication? And what are some strategies to ensure that conversations are productive?
Absolutely, absolutely. So, of course, communication is key. Absolutely. So if we look at it from the sense that, many of our emotional stressors can be a result of poor communication, right? Holding in things due to feeling guilty about bringing up the topic, or just having these uncomfortable feelings or thoughts and not knowing how to express them, feeling resentment in certain situations, or maybe just the idea of sweeping things under the rug in order to avoid further conflict, right? Because it's this idea of we're already kind of working our way through maybe an overwhelming situation, navigating the disease, what that looks like. So with communication, it's very important to find that space to be open and honest with your partner about what's going on in a collaborative way. So some examples of that would be, maybe sorting out your feelings of what you want to say, how you're feeling, and maybe being able to write those feelings down so that when you have a conversation with your partner, you're able to really be clear and concise about what it is that you would like to communicate. Um, Another suggestion would be setting aside time to have conversations, really carving out maybe a day a week or a couple times a week to say, hey, this is our time to be able to bring to the table maybe some of those tough conversations or uncomfortable conversations so that you can really maybe wrap your brain around what it is that you want to say and be able to receive what your partner has to say. Because it is sometimes challenging to be able to navigate through conversation out of the blue, especially with so many other things going on. It could be a shock, or you can't really formulate your thoughts or emotions behind what you're really feeling. So again, setting aside time and writing down what you want to say so you can better communicate that. And just to piggyback off of what Margie was saying earlier, I also recommend seeing a therapist, right? That neutral third party that can help you all focus on communication skills, work on the relationship, how it feels to communicate uncomfortable conversations and uncomfortable feelings, and really having that third party there to set the tone and give advice, give tools and strategies. I can't encourage that enough. The VA has resources that you all can reach out to. Um, and I think that's a big help just to have someone to bounce ideas off of, especially when it comes to communication.
Excellent. Thank you for that, Ebony. And, I would like to say that that's one strategy that has worked for me tremendously, not being very open about sharing how I feel. Being able to write it down also takes out some of that emotional charge for me as well, so that when we do talk about it, it is more from a neutral standpoint. So I appreciate that. Thank you.
Mhm.
Nick and Margie, what strategies have helped you tackle difficult conversations, and what do you do when emotions are running high?
You want me to go first? All right. Well, I think first and foremost, we have to remind ourselves, me especially, not to take it personally. Like, he has a much shorter, a much quicker trigger than I do. And I am not a confrontational person at all. Never have been. I would much rather, the floor swallow me whole than, in the middle of a conflict. So, I have a tendency to shut down, and he takes my silence as anger. And it isn't that. I just have to escape. That's just who I am. And fortunately, after being married 39 years, he's figured that out. But anyway, so I would say, we have to remind ourselves not to take it personally. In so many cases, that whole escalation or whatever is causing those emotions to run high is probably caused by the disease or the situation caused by the disease. So, so I think that's first and foremost. The second thing that I try to do is I try to redirect him. At this point, cognitively, he's not who he used to be. Exactly. He's great, but he's, there's some shortcomings now. And so I find that if I redirect, that has a tendency to kind of de-escalate some. And I think a lot of, just trying to identify what caused those emotions to run high in the first place. And I think for him, and it's very obvious to me in a lot of cases, and maybe not as obvious to him, is it's really a loss of control, and a loss of things that he used to be able to do, and kind of the grieving of those losses. And so I have to remind myself that oftentimes that's what it is. It's just frustration. It's kind of like a 2-year-old when, they want it, they know what they want, but they can't express that to you. And they get frustrated and they act out. And I sort of feel like not to say you're a 2-year-old, but okay. Just, it's kind of like that frustration level gets to the point where, the smallest thing can set him off. And I just have to sort of identify those things in my mind and go, okay, he's just frustrated. It's because of, the lack of whatever, probably lack of control because of something he can't do any longer that he thinks he should be able to do and can't. And then just don't take it personally. It's not a personal affront. It's just, it's just a problem that day. And we also find that, 20 minutes later, it's forgotten, or we'll say, why did we get so upset a minute ago? Oh, okay. So we just try not to kind of hold a grudge or keep count of those little, those little arguments or outbursts or whatever. And, we just take it for what it is and roll with it. And I know, I'll say this again, but humor for us is huge. You have to laugh about it because sometimes it's just so blasted pitiful. What else can you do?
What are you gonna do?
Yeah. So we try to laugh about it and then move on and don't allow it to drive a wedge in our relationship, because we're a team first and foremost. We always have been, we always will be. And we're all we got sometimes. So, our team mentality has to stay really strong. And so we're not going to let something as simple as a little argument or a little upset, change that.
Mm-hmm.
Yes.
Sorry, I talked too long. So now.
No, I'm glad you went first, because you pretty much covered it all as usual. For me, I just try to, like she said, I would call it the rule of 10. But is this really going to matter in 10 seconds, 10 minutes, or 10 years? If it doesn't, then can't be all that important. And the other thing I try to do, not very good at it sometimes, but I try to do the whole breathing thing, and if I concentrate on my breathing before I talk, then it kind of gives me an opportunity to think about my response, because otherwise, like she said, my trigger is short. So, and that causes a lot of problems sometimes.
And we also laugh about, is this a hill we're willing to die on?
Yeah, that's right.
Like, it probably isn't. So let's just move on.
Yeah, and we do that a lot.
All right. Thank you, Nick and Margie. That was fantastic. So Nick, we're going to move on to the next question. And I know you can relate to this probably as I can. But as veterans, we have this mentality that nothing can hold us back. And we are going to power through no matter how bad we feel. Nick, do you believe that our suck it up mentality adds stress or creates difficult emotions between a veteran and their care partner?
Oh, you're absolutely great question. A great point. Yeah, absolutely. And one of the things I was thinking about is that, as veterans, you're right, absolutely. The people like us, kind of get attracted to the military because of that. And it's very hard for us sometimes to, to actually understand that and then apply that very fact. It's tough.
Yeah, absolutely. Margie, what emotions or feelings stir up when you see Nick push himself despite how he physically feels?
Well, first of all, I was going to say I find, as a nurse, seeing other people cope with chronic illnesses, I find that his can-do attitude and suck it up is actually a huge benefit to him because he doesn't give up. He could very easily, years ago, just given up and just, quit the fight and be gone. And you can do that. You can just give up and that's the end. And he doesn't. Every day, we kind of kid about it. It's not like, unfortunately, that once you get your hip replaced, you can, you'll finally be walking again. You won't have to use the wheelchair or the walker or whatever. And that's not it. It's every day he wakes up and it's the same as the day before, or maybe even a little bit worse, depending on, how his progression goes. But he gets up every day and he fights every day and he puts on his best face and, best foot forward kind of thing. And so I could not be prouder. And when I see him push himself, that's all I feel is pride. I just, because he does it every day. And I know there's a lot of people, maybe myself included, who might not do that. And yet he does. And it's years and years. He was diagnosed in 98. So he has been doing this for a long time. He was good until about 2008. But then the walking, stopped, and he's been in a wheelchair full time now for 10 years. And so it's not been an easy road for him. And yet he keeps on fighting. And I give, that military mentality, all the credit in the world for that. I have to give myself a little bit because I do push him.
Oh yeah, big time.
And I do find that I have to save him from himself sometimes. Like, well, it's sitting right here. You can't see it, but we have this hand bike, and he'll say, I'm going to go do the hand bike. And about 20 minutes go by and he's still doing the hand bike. And I'm like, babe, you should probably pace yourself a little bit, because he'll overdo it and then he can't feed himself dinner because his hands are just done. He just can't do it. So I do have to sort of save him from himself sometimes. But all in all, that can-do mentality, that has served us well.
Beautifully said. Thank you, Margie. I really appreciate that. All right, Ebony, let's hear your take on this. How does a military way of thinking impact a relationship when one person is the care partner?
So yes, really to piggyback off of what Nick and Margie have already stated, I was actually going to come from the perspective of it can be a fine line, because in some aspect it's that can-do mentality, and I'm going to push forward to to do the things that I can do within limits, right? So that's what I kind of want to bring this to, is doing what you can do within limits and being able to have that collaboration between care partner and veteran to say, hey, you know what, let's try this today and let's do the best that we can today within your limits, right? And being able to support one another in that. But also the military attitude from the perspective of not wanting to ask for help, right? It's a pride thing. It's I can do this. I've always been able to do this. So being able to say, hey, I need help can sometimes be a challenge. It can be a barrier for veterans to speak up and really ask and put forth their needs. So with that being said, I really think it, again, goes back to communication, knowing your loved one, and creating that that atmosphere of, you know what, it's okay. I'm here to support you. It's okay if you need help today. We'll keep trying this together. So I think it goes both ways again. So absolutely.
Thank you, Ebony. All right. Many care partners often feel like they can and should handle everything. Making time for yourself is not selfish. In fact, it will strengthen the long-term success of the partnership as a whole. It is also important for care partners to recognize their emotions and communicate when they are feeling overwhelmed or anxious. Ebony, what is self-care? And can you tell us about the importance of self-care for the care partner?
Absolutely. So self-care, and I'm going to start off with the old saying that I'm sure so many people are familiar with. I'm just going to put it out there. You cannot pour from an empty cup. So that's saying if you're not full, if you don't have yourself well taken care of, how can you really care for someone else, right? So with that being said, self-care is essential in order to care for someone else. So what is self-care? Self-care is taking care of yourself both physically and mentally. So, sometimes when caring for someone else, you get very involved in the other person's care needs, right? Their doctor's appointments, making sure their medications are refilled, making sure they're getting where they need to go. And unfortunately, sometimes your own healthcare needs and mental health care needs may kind of slip through the cracks, right? Because you're so focused on someone else. So self-care from that aspect means following up with your own physical health appointments, calling your doctor, checking in on yourself. If you do have a therapist or a mental health outlet, making sure that you're following up and being honest about your needs and what's going on. Really, really finding outlets in families, friends, self-help groups, places that you can go to be able to really be transparent about what you're dealing with in a safe place. Self-care is basically asking for help when you need it so that you're well taken care of, so that you can put forth your best effort for your partner. And we'll get into this a little bit later, but just finding time to do the things that you're interested in, right? Being able to say, hey, I need to take a break, right? Maybe I need to go have lunch with a friend, or hey, maybe I need to take some time and read a book, right? So you can get yourself back balanced enough so you can get yourself in a place where you can be there to provide that support and care for your loved one. But again, I'll get into some other activities later in the program, but self-care is taking care of self physically and mentally for the care of someone else as well.
Excellent. Margie, how do you communicate with Nick about your needs, and what are some things you do to emotionally and physically take care of yourself?
That has always been pretty easy for us as a couple. I'm the extrovert, so I have to be surrounded by friends and family and fun and activities, and I'm on the go all the time. And so that really hasn't changed. He knows that about me. He's more of, he follows along and has a good time, but I think if it were his choice, he would, he'd be okay with staying at home kind of thing. So when I tell him I'm going out with my college friends, or I'm meeting up with some of my nurse friends, or I'm meeting up with, some of my old military wife friends, he's totally okay with that. And I don't go for very long because I can't, be away from him for too long. But I've always done that, and he's always been great about it. And so that's something he just sort of expects that I'm going to do. And I always bring him home food if we go out to lunch or something like that. And so he gets the benefits too. But yeah, it's always But anyway, and we are incredibly blessed, both of us, with families who get along famously and seek out excuses to be together. I'm one of 5, he's one of 4, and we children, and we, we get together all the time, and so that's wonderful. And our families, both of them, to a person, are very, very supportive. They'll do anything for him. They'll do anything for me. So for me to ask for help is nothing. I have people lined up that would want to help, which is wonderful, and my friends as well. So so we're very blessed in that regard. And also the fact that I was able to retire from my job to take care of him full time. I don't have the stress of that anymore. And we live in a home now that is handicap accessible. So a lot of those stressors that I'm sure many caregivers have, we've been able to address over the years because he has had this for such a long time. And so, I consider myself very blessed. I have lots of hobbies. I have dogs, 2 dogs that I dearly love to go outside and play with or walk or whatever. I have friends I go walking with. We have a wheelchair accessible RV that we go all over the place in. We can't stay in hotels or anything. So we're out and about a lot. We're not one of those stones that gathers moss. We move and we shake all the time, and it's good for him. And I think that keeps his mood and his attitude up, and it certainly is, keeps me the same. I just drag him along, and he comes
Oh, yeah.
and so I don't know, I think that's been easy for us, honestly. I just feel very blessed with our friends, our family, our support system. Certainly, his healthcare team is top notch. All I have to do is email, and I get a response, immediately. And so we really have a lot of great support in place. So I'm lucky.
Excellent. All right. Thank you, Nick and Margie. Okay, we are going to move on to the care partner resources. So we're going to transition a little bit here. Ebony, can you tell us about the VA Caregiver Support Program? Who is eligible to participate, and how can veterans or family members access the programs?
All righty. So the Caregiver Support Program at the VA, it actually encompasses two umbrella programs. The first program that I'm going to speak on is the Program of Comprehensive Assistance for Family Caregivers. And most people have probably heard of this program, as it is oftentimes referred to as the stipend program. It's the program that the VA will pay your caregiver to care for you. And that program was developed with the idea that we certainly understand that caregivers oftentimes make personal sacrifices. Margie, I heard you mention that you were able to retire early so that you could really focus on the needs of your husband, right? And so we do realize that, hey, sometimes that has to happen. So with the program of comprehensive assistance for family caregivers, if and when found eligible, caregivers are entitled to a monthly stipend along with other benefits. So in order to be eligible or to apply for that program, and let me note that it is an application process and that eligibility is determined based upon clinical need. But initial criteria would be that the veteran is at least 70% service connected. Um, and right now, the program is servicing veterans that served on or before May 7th, 1975, or on or after September 11th of 2001. We are in the process of expanding. So next year, probably around October of 2022, the program will be expanding to include veterans of all service areas that can apply if they meet the other eligibility criteria. Again, so the program is looking at, does the veteran need assistance with mobility, eating, toileting, dressing and undressing, grooming, hygiene, and assistance with any prosthetic devices if necessary. Another eligibility criteria is safety. What does it look like in terms of the veteran needing safety on a daily basis? And we're looking at that over the course of at least a continuous 6 months to be able to be eligible for our program. So again, with that, I do advise people to consult their local VA for additional criteria. You can certainly check out our website, caregiverva.com, for additional information, because that's certainly just a brief overview of the eligibility criteria. And then the other program that I would like to speak on is the program of general caregiver support. That program opens the door for resources for our caregivers. Telephone support, online support, peer mentoring support for our caregivers, a host of information and resources, education, training. And in order for a caregiver to be eligible for that particular program, it's really you call in, you do a brief intake process. The veteran does not have to have a service-connected disability in order for the caregiver to participate in the general caregiver support program. Additionally, we're looking to see if the veteran has a need for assistance with one or more activities of daily living. Again, consult your local VA. If you're interested in that, I cannot enforce that program enough. It's a great program for resources and training. And then just in general, we have our National Caregiver Support Hotline. That line is staffed with licensed clinical social workers that are there to talk about our programming, eligibility criteria, and just there to offer brief support over the phone, and also to connect people to local VAs for additional resources and support. So again, that's a brief overview of our two programs housed within caregiver support. I encourage each and every one of you to check it out, see if you're eligible, and please just ask questions about it. You know, we're here for the support of the caregiver. That's what makes our program so, unique. So please feel free to reach out to your local VA with any further questions and check out that website.
All right, thank you, Ebony. Now, this next question, Ebony, we heard from Tamara, who said she was denied support from the VA. We also heard from Keith, who said he's been told no over and over again, and he's feeling very discouraged. What are the next steps for Tamara and Keith?
So whenever there's a denial in place, I would encourage veterans and caregivers to reach out to their local VA, number one, to inquire about appeals options. When it comes to our program, there are various appeals options depending on how you would like to move forward with that appeal. So number one, reaching out to your local VA caregiver support department for appeals options. You can also contact the local patient advocate to address and inquire about any options for appeals. If we're talking about claims in general when it comes to being denied, for example, for a service-connected claim, I would encourage you to reach out to your local VBA, the Veterans Benefits Administration. Contact a veteran service officer. Find out your options for appeals and see how you can initiate that process and what that looks like depending on your particular circumstance.
Excellent. Nick and Margie, what resources have you found helpful in your journey?
I would say right off the top, the VA staff, first and foremost. We have been to numerous VAs through, in the country, because sometimes a need pops up and we're out, in the RV. And so we've been to a few. Our goal was to see most of the national parks in the United States, and we've seen a lot of VA hospitals instead, but that's okay. And to a person, it's been outstanding. The care is always top notch. Just they'll do anything for us, and we certainly appreciate it. So I would say the VA staff first and foremost, and then like you spoke to, Ebony, your veteran service organization. We happen to use the PVA. They're terrific with regard to recommending resources and then following through to make sure that if you applied for a certain program or whatever, that it actually went through, and they give you suggestions on how to navigate some of the application process. The other thing would be obviously the National MS Society. We've gone to many seminars. We've done the MS walk a lot of times. We've used the MS Navigator quite often. We actually went to a retreat in Ocean City, Maryland, and had a great time, a weekend retreat. That was lots of fun. And then certainly the caregiver program. As a matter of fact, I've done 2 classes just this week. One was an exercise class, and one was the caregiver mentoring panel, and that was outstanding. I learned a lot. I always do. And so that was great. And then we also have a local MS support group that we belong to, and they meet one Sunday a month, and it's been great for us. We originally didn't participate because Nick felt like, if I go, this was back when he was still walking, I'll be like that guy, the person that goes to Weight Watchers that everybody else thinks is too thin to be going to Weight Watchers. So he didn't want to participate. And now he's found that, that he learns a lot from them, but he gives a lot too. He's actually probably one of the worst off there now, unfortunately, but he's able to sort of network and then give suggestions to people as we've navigated a little further down this road than some. So anyway, there's so many resources out there, and I recommend all of them, and we use them all. There is not just one that we find the most helpful. It's a team effort. How about you, Ben?
No, I 100% agree. So I don't know what else to say besides. You're here. I 100%.
All
Yep.
right, thank you, Nick and Margie. All right, so we have just a couple minutes here. So I want to get to this question that we have from Lynn. Lynn needs more support in the home to help with her husband's daily needs, but she's not sure where to start. Ebony, what are types of home services that are available for veterans, and how would someone find this information to see if they can receive these types of services?
A great question. I'm glad that was addressed. So number one, I really encourage individuals to reach out to your primary care physician. In that office, they are staffed with a care manager, a social worker, and of course the primary care physician. One of the programs available, and again, of course, it's if criteria is met, of course, there's an evaluation process. But one of the programs at the VA is called the Home Health Aid Program. And with that program, the VA partners with an agency that can send a home health aide into the home to meet those unmet needs for the veteran. And they can provide up to 16 hours a week, depending on need, eligibility, things of that nature. So again, up to 16 hours a week of a home health aide that can come in and help out with those activities of daily living. So then that way the spouse or the caregiver can have that time to maybe engage in some self-care or engage in some self-help groups. Another option would be respite, right? This is huge. Sometimes caregivers just need a break, and you don't know how to quite go about by saying that, right? So the VA does offer a respite program. Again, I encourage you to reach out to your local VA primary care department and find out how to go about initiating that referral. The respite care program does provide the opportunity for the veteran to do inpatient or outpatient respite. And that's just having someone sit with the veteran in the home or having the veteran come to a facility, right, to be able to have that 24-hour care if the caregiver, for example, has her own needs to take care of or needs to go out of town for some reason or has a long-standing doctor's appointment that needs to be taken care of. So again, those two programs, respite and home health aid, I do encourage people to check those out and ask about those programs at your local VA.
All right. Thank you all for sharing your helpful advice and strategies to manage MS as a partnership. I'd like to ask you all to share your top 3 takeaway messages that you want our viewers to know from today's program. All right. So Nick, we'll start with you. What are your top 3 takeaways?
I tell you, I just came up with this. This is new. Honestly, I would have everybody rewatch this program and take notes because you guys have given such outstanding guidance and information that started all this. It's truly great stuff that you put out. The second one is don't forget to ask for help. I wasn't very good about that, especially when I got in the wheelchair and because I needed help with everything, like for example, opening doors. And so what I did, I found was helpful was when somebody opened a door, I thanked them, looked them in the eye and thanked them so they understood that I wasn't just doing it rotely. I was doing it. So that, I think, was a good help for them, those people to help. And for me, because I got a lot of joy out of doing that. So sorry about that. The last one is just understanding all the programs that are out there. It's and taking care of the taking advantage of those when you can. Those are the three things that I would have the big takeaways.
Thank you so much, Nick.
Mhm.
How about you, Margie? What are your top 3 takeaways?
I'm going to have to echo some of what Nick said. The first thing I would say is stay informed. And if I had it to do over again, I would probably check in with my veteran service organization, maybe quarterly or twice a year or something, and the MS Society as well, just to see what resources are available, or is there something that you didn't qualify for before that maybe you now qualify for. And those things change, like you were saying, Ebony, about October of next year, the comprehensive caregiver program is going to be open to a lot more people. And if you've been turned down once, you may not know that unless you listen to this program or go to your veteran service organization for that information. So I would say just stay up to date, stay informed. Things are changing all the time, and for the better. And then secondly, I would say what Nick said, ask for help. Know that you're not alone. There are a lot of people who have learned through the School of Hard Knocks, us included, who would love to share those pearls of wisdom with you and save you from some of that trouble. I think just asking for help is huge. And then, as we've talked about before, taking care of yourself. Keep those doctor's appointments, keep those friendships going. Get out of the house, use respite care, which we have done, and he enjoys it. He loves being around the other veterans. And the other thing is, it's a good way for the staff at the VA to kind of give a whole look at him. And they, when we happened to go to Italy I went to Italy to visit our active duty son who's stationed there. And I didn't want to bring him just because we didn't know how we could navigate somebody in a wheelchair through Italy. But anyway, so he stayed at the VA, and when I got back, it was so great because he had learned a bunch of things. They had suggested some things, and the staff there had kind of looked over him head to toe and came up with other treatment options or resources that we didn't even recognize. When you're doing it every day, you sometimes kind of fall in that same habit, and you maybe would miss some new cutting edge thing that's come out. So anyway, those would be my 3. Stay informed, ask for help, and take care of yourself.
Mhm.
Excellent. Thank you, Margie. All right, Ebony.
All righty, and not to again piggyback, but I was going to start off with asking for help and really just hitting home how important that is, right? I think sometimes, number one, sometimes we don't even know what to say in order to ask for help because we don't know what's out there. We don't know how to, communicate our needs. So in order to address that, I say again, reach out to your MS local chapter, the MS Society local chapter, and your VA, and ask for help. Talk to the local social worker and say, hey, this is our situation. Do you have any advice? Do you have any recommendations? Do you have any suggestions on what may work for us? Secondly, self-care, self-care, self-care. Sometimes we can get caught up in this idea of getting burnt out, right? Because we're putting so much effort into making sure that our loved ones are so well taken care of, right? But again, we lose sight of ourselves. So I really want to just, again, hit home on the fact that follow up with your own healthcare needs and mental health care needs. Find your outlets. Talk to family and friends, support groups. The VA has support groups, again, through caregiver support that are there over the telephone, virtual appointments, online opportunities to really find a support network for you. And again, the MS Society also has support groups for both veterans and caregivers. So take care of yourself. And last but not least, communication is key. Making sure that between you and your partner, making sure there's a collaborative effort. I do want to acknowledge that sometimes that can be challenging with the course of the disease progress. But I want to hit home on the fact that communication with your partner is essential, making sure that one another feels that support from each other, even through the tough times, being able to talk about those things. So thank you all.
All right. Thank you, Ebony. Thank you guys for sharing that. You guys bring up some really excellent points. Thank you to everyone who submitted your questions and your comments. And thank you, Nick, Margie, and Ebony, again, for being here with us today and giving us your experience and expertise. Before we close, I would like to remind everyone that you can connect with an MS Navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You will find research updates and news, self-help groups just for veterans and active duty military, more ways to get involved, and upcoming events near you. To learn more about veterans in MS, visit nationalmssociety.org/veterans. To learn more about the VA Caregiver Support Program, visit caregiver.va.gov. Remember to connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitter, YouTube, and LinkedIn. The Elite Warrior Project podcast shares real-life experiences and stories from fellow veterans who have been diagnosed with MS, as well as expert guests to talk about the various resources available to help improve quality of life and navigate the many challenges presented when living with MS. You can subscribe or listen to our episodes on Facebook Podcast, Spotify, or Apple Podcast. You can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I encourage you to like, subscribe, and/or get on the Society's mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. Thank you again, Ebony, Nick, and Margie, for sharing your knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at nationalmssociety.org/MSexpert. I invite you to join us on March 15th, 2022 for our next Ask an MS Expert Veterans program. Lastly, it's important to get your feedback on today's program. You will see a survey pop up when we close out this webinar. Completing the survey does make a difference, and it only takes 1 minute to complete. The information you provide helps continuously improve and shapes future segments. So we'll see you next time.